So he's using both in the action.
Nothing further.
Nothing further.
You can step down, sir. Thank you very much.
Your Honor, may Mr. England be excused from the courthouse?
Any objection?
None, Your Honor.
Okay, so you're going to release the next witness?
If counsel, we spoke briefly that counsel may be willing to stipulate and avoid testimony of Brittany Roberts, the animal control, that the dog seen by the veterinarian was in fact Meatball, the dog in the video. Is that still true, counsel?
I would stipulate to that, Judge.
Oh.
To the chain is what you're
To the chain.
Okay.
Correct. Okay, so
That stipulation is placed on the record.
thank you very
Next
much.
witness, then?
Dr. Marilyn Begany.
Okay.
I didn't want to go that far.
Please raise your right hand. Do you swear affirm to tell the truth, the whole truth, nothing but the truth?
I do.
If you have a seat, state your name and then spell it for our record, please.
Dr. Marilyn Begany, B-E-G-E-N-Y.
Thank you. Counsel?
Thank you. Good morning, Dr. Begany. I wanted to, before we get going, I wanted to note you carried a piece of paper in with you, and I just wanted to state for the record, what have you got on that piece of paper?
It's just the physical exam findings from the day that Meatball was brought in.
All right. If you need to refresh your recollection by looking at it, will you kindly let the court know for the record that that's what you are doing?
Absolutely.
Thank you. Okay. And what is your occupation?
I'm a veterinarian.
All right. And how long have you been practicing veterinary medicine?
Since 1986.
Okay. And where did you go to veterinary school?
Michigan State University.
Thank you. Do you work at Eastpointe Animal Hospital?
On Wednesdays, I do.
All right. And in your practice there, do you examine dogs?
I do.
On or about Wednesday, February 24th, 2016, did you have the opportunity to examine a male dog named Meatball?
I did.
And what color was that dog?
A brownish tan.
And if you, the best of your estimation, what kind of dog was it?
English Mastiff.
All right. Thank you. How did he come to be at your clinic?
He was brought in by animal control because he was taken because of an abuse case.
Objection, Your Honor, just in regards to hearsay as to what... I can understand if it's being brought in and asked what she did next, but it's hearsay.
It's not for the truth of the matter.
Control officer.
But I'll move on.
Okay, thank you very much.
Sure. What did your examination of the dog consist of?
Okay, we did a complete physical from oral exam, head exam, just checking for any injuries. Purported that he was brought in because of...
Objection, Your Honor, hearsay.
That's, it goes to why she did those exams, Your Honor, so I think...
It's not allowed for that purpose only. Go ahead.
Thank you.
Okay, just give me a full physical exam to see if he had any injuries or anything that needed to be taken care of, because that's what he was brought in for.
Okay, so based on your conversation with Officer Roberts from Animal Control, you felt it necessary to do that sort of examination?
Exactly.
Okay. And what, if anything, did you take note of on the dog during that examination?
Basically, the main thing is he had some injuries on his head, more like raised injuries, like what we would call edema or welts on his head. It's kind of like a recent injury, we would call like a edematous soft tissue injury to the head. When you pressed on it, he would cry, palpated like tenderness to that area. The rest of the exam, he walked fine. The rest of his physical, he seemed okay, but since he did seem like he had some injuries, we did some x-rays on him.
Okay. And first, let me ask you, had you ever examined that dog before, ever met that dog before?
No, never saw the dog.
Can you describe the dog's demeanor or disposition?
Oh, he was a wonderful dog. Very friendly, never was fearful of us. You know, he was very outgoing, never seemed fearful or resentful of us touching him or anything. We didn't have to muzzle him or anything like that.
Okay. Now, you said that he would cry when the tender part of his head was touched.
Right.
Did you ever actually hear him barking?
No.
And he stayed, how long would you estimate, how many weeks, roughly, did he stay at that clinic?
I don't have the whole record here, but I think he was there about 2 to 3 weeks.
Okay. And during that time, whenever you saw him, Was his disposition the same as you just described?
Always. There were times because we only had very small runs that we just let him have the run of the clinic because it's such a large dog. And there isn't much for a large dog to have in a small run like that. So we just let him have the run of the clinic. We even had a clinic cat who we never put away. And they got along great, actually. Even nose to nose, and the cat would nuzzle on him. He never had any problem with the cat at all.
Okay, thank you. Now, when you had to take the dog's x-rays, did you have to manipulate him a little bit?
Yeah, basically they wanted x-rays done, for the case.
Okay.
So we had to determine how many x-rays, obviously based on what injuries he looked to have. We did the head of the skull area, and we didn't see anything on that. His legs, he was walking fine, so we didn't feel the need to do that. But in any kind of case of trauma, you always take the chest and lung area, because those are vulnerable, even though you may not feel injuries on the external part and they may not vocalize. The rib cage is always vulnerable to injuries, so we did do that. Placing him on the table, he was a little sore to be placed on an x-ray table, so he was fine for the skull, obviously the tenderness of the head area. You couldn't put him on his back to take the x-rays of the chest area.
Is that, you said, due to he seemed sore?
Because he was a little sore.
Okay.
So that's fine, because you can take chest x-rays either way, either laying on the back or what we call a DV view.
Okay.
So he was fine for that, because that's just laying in a normal position, a sternal position for a duck. But then, surprisingly, when we did take those x-rays, it looked like there possibly was a 9th rib fracture and even possibly an 8th rib fracture.
Okay.
But since the line was so fine, we did want to send it out for review for a radiology expert to confirm that.
So you did that?
We did.
Okay, and to whom did you send those x-rays?
We sent those to Blue Pearl. Blue Pearl has a radiology expert, and she confirmed that the 9th and
Objection, Your Honor, as to what Blue Pearl said.
Your response?
That's fine, I have no problem.
State the objection, ma'am. You're just going to have to state what you know.
Okay.
Okay, thank you.
Okay, Your Honor. Did you ever observe any kind of aggression or any negative behavior to humans from this dog?
Never. Like I said, he was there 3 weeks. The girls would even just lay with him on the ground. I mean, because he became almost part of the family, he never ever growled at anyone.
Okay. I have no further questions.
Thank you. Cross-examination?
Is Dr. Beckenham, am I pronouncing it correctly?
Mm-hmm.
Okay. You indicated that the first day you saw Meatball was when?
Can I put my glasses on here?
So you're referring to your notes, Doctor?
Yes, I am.
For purposes of refreshing your recollection. Okay. Any objection to that?
None, Your Honor.
Try my days down here. Let's see. I believe my date's partly cut off on the bottom here. I believe it's February 24. I'm sorry, Brittany. I'm sorry, Dana. The date when it got copied,
No problem.
copied below that.
Do you have the original record, or Counsel, would you like
I don't
to view
have
that
the
at some point?
Very well. Would it be safe to say that we both believe that it's the 24th and that appears to be what's on the
Yes,
bottom?
when it recopied, it copied. Yes.
Okay. Now, there is any documentation that you fill out when you conduct this investigation into Meatball. Do you have any way to take notes or things of that nature? Did you make any reports?
Yes.
Okay. And would that be a patient examination form? Is that correct?
Yes.
Okay. And you've been referring to your notes throughout this examination. Is it safe to say that what you're using to help remember is in fact the patient examination form? Okay. You are filling out this form as you're conducting the I guess, checkup of Meatball?
Yes.
Okay. And there are certain boxes that are at the top of that form that that indicates, you know, what the dog's attitude was.
Right.
Do you know what was the dog's attitude on the date of the 24th?
Can I put my glasses back on?
Absolutely.
Behavior friendly.
Okay. And attitude, I think it indicates at some point in time?
I'm going to refer. BAR means bright and alert and responsive.
Okay. And body condition?
Okay, I'm going to have to. Normal.
Okay. And then throughout the lower part of that document, or the middle portion of that document, there are basically a list of different body parts that you check
Right.
out. Is that correct? Primarily, most of those appeared to be normal to you. Is that correct?
I'm just going to put my glasses on. A lot are marked N for normal, correct?
Okay. A few were marked A for, I believe, abnormal. Is that correct?
Abnormal would be skin. Obviously, that was the traumatic skin in the head area.
Okay.
A tooth was chipped. That was marked abnormal. Head would have been the skin area. That was it. He had an ear infection. That was abnormal. The hair coat would refer back to the skin, and the musculoskeletal. That marked that normal.
Okay. Now, then you have some comments listed throughout underneath those. Is that correct?
That's when you go into your more specific assessment after.
Okay. I'd like to begin at the top of the head. You indicated that he appeared to be soft and tender to the touch. Is that correct?
Right. Well, that would be the traumatic, palpable, soft tissue area.
Did you observe anything on the top of his head?
Yes, you did.
Okay.
Yeah, you could actually observe it, and not only feel it, you could observe that it was raised and.
Okay. You indicated it was a small area. Is that correct?
Right.
Okay. In your estimate, what would be what's the size?
1 to 1.5 inch area.
1 to 1.5. Did you take any photographs of that area?
No.
Okay. Is it standard practice for a veterinarian to take photos of any sort of injuries?
Not usually.
Okay. But you were aware this dog was brought in regards to a criminal case, correct?
No.
No. Okay.
Well, not at that time.
Excuse me, I'm not a doctor, so medical terminology. I think it says in your notes, if you can read what number 1 says.
Excuse me, 1 minute. You want her to read that out loud? Is that or just to herself?
Or she can read it out loud, Judge, because...
Any objection to that?
None.
Okay. Number 1, small area top of head, palpate soft and tender to touch. Old scabs on head, old scars behind ears, possibly secondary to fly bites.
Okay. So you indicated that there were old scabs on his head as well?
Old scabs behind ears, possibly secondary to fly bites. Dogs commonly, on the tips of their ears, flies will bite them, and they will scar up secondary to that. Those were the scars that I'm indicating.
I was talking about the scabs portion, because I believe your report mentions...
Old scabs could have also been secondary to the trauma, because that wasn't the palpable thickened area that was... So there were some superficial scabs that could have been scratches to the head that were already in the healing phase within 2 to 3 days, 4 days. So those would have been superficial. The thickened area was more of a edematous area that would have been more of a secondary trauma that was more severe.
Okay. The dog, you said when you first, other than the mark on his head, the dog didn't appear to be in any pain whatsoever?
No.
Okay. Didn't feel tender when you touched the dog's ribs at all?
When we put the dog on the table to try and get the x-ray, he was appearing painful on his side. But so when we took the x-ray and realized, because when the rib starts to heal and get connective tissue and start stabilizing, it won't start showing pain because it's starting to stabilize.
Okay.
So we didn't necessarily feel pain as we're feeling down his chest, but as he wanted a position on the table, he was feeling uncomfortable, so that was obviously possibly secondary to that rib fracture.
Okay. Now, in your notes regarding the X-ray, and it's the last portion, I think, down by the treatment plan, there's a line in there. Did you write on this form that the dog is not painful?
Right, dog is not painful.
Okay. And there's no other mention about the dog being in any sort of discomfort when trying to place the dog on the X-ray?
I didn't write that in the notes.
Okay.
It was just an observation. When the technicians could not get him to lay on his back, I said, then just go ahead and take a DV view versus a VD view.
Okay. And you conducted, and you wrote this patient examination form out after you conducted the examination?
Right.
Okay. So, just for your records, you would, after reviewing this, you wrote immediately following this examination that the dog was not painful. Is that correct?
Right.
Okay. If the dog had shown signs of pain, you probably would have included that in your report. Is that correct?
It's more that he wouldn't sit for the X-ray on a VD, so sometimes you can conclude that a big dog didn't want to go on his back. So this was written more that he didn't want to position himself. So again, it was not a conclusion that it was due to the fracture. It was like he didn't want to lay on his back because he has a very large dog. If that helps, though.
There was nothing other than the fact that to searching for X-rays, when you originally viewed him, the dog didn't appear in pain.
Walking in and giving him a complete physical, he didn't appear in pain.
Okay, and your notes...
Other than the head.
Okay, and what is it, your notes indicate the dog was not painful, and what is no sign of, I believe it's pneumotions?
No, that meant on the X-ray, often when there's a rib fracture, if there's trauma to a rib, there could be trauma to a lung, and pneumothorax would be if there's a lung collapse. There was no sign of air in the lung causing a lung collapse.
And in your notes, you refer to what is a nick line or a ghost line?
Well, then we're getting into why we referred to the specialist.
Okay.
We were just going to make sure that I wanted to confirm, especially if this was going to be litigious, that that was not going to be that it was a true fracture line. I believed it was a fracture line, and there was possibly another fracture line, so that was why it was referred to a radiologist for consult.
Why would you think this is litigious when you said you had no idea of why this dog was brought in?
Hold on, we can only have you talk one at a time. So.
In case this was going to be something that was going to need to go further, I wanted to make sure we were calling this. Even if this was not litigious, we wanted to make sure this was, we do this with cases all the time. Even if it was another hit by car or anything like that. Always want to make sure that if this is going to be something that was a fracture, we send things to the Blue Pearl Radiology all the time to confirm a fracture or not a fracture.
Okay, well, just from my knowledge, what is a nickel line?
Dr. Rose can explain that. That's if a shaded area goes over a bone, it may appear to be a fracture or not a fracture.
Okay. And the ghost line?
Same thing.
Okay. During the normal course of treatment, if you would have seen this dog, would you have sent out these x-rays for a second opinion?
Yes.
Okay.
Yes, absolutely.
And did you do any other follow-up examination?
I only work there Wednesday, so we have another vet there who's actually there the other days of the week, so he would have done the follow-up.
Okay, and prior to the examination, did you have any chance to review Meatball's previous medical history at all whatsoever?
No.
Okay, so you weren't aware if he had seen other vets to that date? Or
I did not.
Or had,
the other veterinarian may have, but I did not.
Okay. let me, go ahead. Now, do you see quite a few rib injuries with dogs?
Often trauma.
Okay. But there's no indication in your review of Meatball of when this rib injury occurred or how it occurred, correct?
I'll refer to Dr. Rose, because as an expert, she has a time frame in mind, which she actually put on her report, so I won't go there.
I'm just asking
and
about...
how? As I said, it's often trauma. I can't speculate how trauma unless I refer to a video. It's often trauma.
Okay. But just from your review, you have no idea of, you say it's trauma, but you don't know when this trauma may have occurred, correct?
I'll refer to Dr. Rose. She has a time frame in mind.
Okay.
And as her expertise, that specifies that.
I'm just asking not to be perfect. You have no idea how this injury occurs.
How would I? I could not.
That's all I was asking.
Unless I would be there, I could not.
Absolutely. Okay. Nothing further.
May we direct?
I have a very brief, Dr. Begany, I know obviously you just testified you weren't present at the incident, but did you, at least one time, have an opportunity to review with one of the Eastpointe officers the video of the incident?
Yes, I did review that video in response to that question.
Okay. So, in your veterinary medical opinion, would rib fractures like this be consistent or inconsistent with what you saw in the video?
In reference to that video, it would be...
Objection, I think that this is going to call for something that is outside her scope as an expert. She's indicated she's referred out everything about any sort of injury to another individual because this is not her expertise. So I don't think she can make any sort of conclusion of whether or not the injury to that rib is consistent with what occurred on that video.
The response?
Judge, while I have called Dr. Begany as a fact witness, I could, I believe, qualify her as an expert in veterinary medicine who's been practicing for many years.
Is that an issue for you, Mr.
The judge, you can get to it, and I think it also calls for speculation as well, but I don't think that she's an expert in the level to say that this injury was caused by this video. I don't think she can connect the dots.
Well, I don't think that was the question. So the question was whether the injuries are consistent with the actions that she observed on the video. And so she's not indicating, I'm not going to make the argument for you, Ms. Goldberg, but I believe that was the question.
That is the question.
What's your objection to that response if in fact she's already stated, doesn't know how the injuries occurred, she's already indicated that how would she know, she doesn't know. Now the question is, and it's a follow-up question based on your cross-examination, whether or not the injuries are consistent, and for purposes of exam, that's the only real question.
I guess it's pure speculation is my objection.
Okay, I'm going to overrule the objection. I'll allow the question. Go ahead, Ms. Goldberg.
Thank you. And doctor, I don't want you to speculate. I want to ask you to base your answer on your training, your experience, and the fact that you just testified that when you see rib fractures, they are often due to trauma or can be caused by trauma. What is what you saw on the video consistent with the injuries that you observed on the x-rays to the rib?
I believe in a couple instances on that video, what I saw, there were possibilities that the injuries could have been caused by what I saw on that video.
As to the ribs?
Yes.
As to his head, is it your opinion that the injuries on the head or injury was consistent or inconsistent with what you saw in the video?
No, I believe so because there's a brick wall on the house, and that's a possibility that when he was struck or set up against the house, that could have happened in that way.
Okay, I have no other questions. Thank you.
Any additional cross-examination?
When did you review the video?
Exact day, I cannot tell you, but I believe it was possibly 2 weeks after he came in, but I can't actually give you the exact day.
Okay. And in regards to what you indicated was a possible injury to the ribs,
well, it's not a possible injury, it's a confirmed injury to the ribs.
okay. Let me ask you this, then. What portion of the video would you say could have been, or actions of Mr. Spoyer could have caused this?
Well, I believe there's one part where he's actually sitting on the dog.
That's the portion you're referring to?
Right.
Okay. Nothing further.
Any additional?
Very brief. Doctor, you only saw the video one time.
Right.
Was it a while ago?
It was a while ago.
Okay. And I want to clarify for the record, this wasn't just posed on cross-examination, but you, if the court will allow, you said DV and VD
Right.
as to the x-rays, and I wanted to make it clear for the record what those are, what those actual words are.
VD would be when the dog is ventral dorsal, so the dog would be laying on his back, and the x-rays penetrating from the ventral to the dorsal view, and dorsal ventral would be the opposite. The dog is sternal coming from the dorsal ventral. They are actually interchangeable.
Can you say that in plain English for me, the non-medical person?
So if the dog is laying sternal, as they normally do on the floor.
On their stomach? Or?
Yeah, on their stomach.
Okay.
The x-ray is coming down from the back to the front. And if we would want them on their back, it would come from the front to the back. That's the ventral dorsal view.
And that was the view that you believe he seemed uncomfortable?
He wouldn't go on his back.
Okay.
He
Fair enough.
refused.
Okay. Nothing else. Thank you.
Any additional?
Nothing further.
Okay, thank you. This witness may be released.
Yes, please.
Thank you, Randy.
Thank you.
Next witness?
Dr. Michelle Rose.